Hello, everyone. Thank you for being here. Our project is titled Enhancing Accessibility, Occupational Therapy, Assistive and Mainstream Technology for Neurological Disorder. So we have 6 occupational therapy students. Each of us have explored different neurological conditions and the role that technology plays in rehabilitation and occupational engagement. The focus of this collaborative project is to identify how both assistive and mainstream technologies can be integrated by occupational therapists to explore individuals with neurological conditions. So we will take you through our project backgrounds, aims, method, and each of our contributions and our findings for different neurological disorders.
So, just a little bit of an introduction to our topic. This project looks at how OTs are using technology to support individuals with neurological conditions. We talk about how OTs use technology to enhance independence and promote safety and support the rehabilitation process. We also look at both mainstream and assistive technology. And when we discuss mainstream technology, we're talking about things like smartphones, smartwatches, iPads, tablets, things like that are often widely available to the general public, but can be a little bit difficult to adapt for individuals who have these neurological conditions. And when we're talking about assistive technology, we're referring to tools like mobility aids, communication devices, and things like that that support daily functioning. And that's also what's referenced, the same thing as what the World Health Organization refer to as assistive technology. And this project also explores how OTs integrate both types of the technology to improve occupational performance. We also have a little bit of a look at barriers and facilitators that influence successful occupational therapy interventions.
Our group's aim is to explore how OTs can integrate mainstream and assistive technology to improve engagement, safety, and independence for people with neurological disorders. The purpose includes understanding how neurological disorders impact functioning and evaluating the role of assistive and mainstream technologies to promote independence.
As a group, we chose a literature review methodology to investigate our topic. Each member focused on one neurological disorder, which allowed us to understand the unique and shared challenges across conditions. We reviewed a wide range of sources, including peer reviewed articles, systematic reviews, policies, and real world case studies. Our research was guided by the model of human occupation, a key OT framework that helped us assess how technology can support volition, habituation, performance capacity, and environmental interaction. Across all conditions, we focused on how technology could improve engagement, safety, and independence in daily life.
For our report, we each chose a neurological condition to explore. I, Charlotte, chose epilepsy. Addison wrote about Alzheimer's disease. Abbey wrote about Parkinson's disease. Ray wrote about Guillain-Barré syndrome. Millie wrote about stroke. And Dana wrote about multiple sclerosis. My aspect of the report explores the use of assistive and mainstream technologies in occupational therapy for people with epilepsy. The aim of this was to understand how these technologies can support participation, safety, and independence, especially given the wide variation in how epilepsy impacts people's lives. This report covers 3 key areas. First, how epilepsy and common comorbidities affect occupational performance. Second, the types of technology used to support individuals. And third, how OTs can overcome barriers and ensure ethical, effective integration of these technologies within practice. It highlights the growing need for OTs to not only understand the functional impacts, but also advocate and implement technology that supports client centered and equitable care. For the first part of my report, we explore the way that epilepsy impacts engagement in occupations differently depending on the severity. People with mild epilepsy may still avoid activities like driving or cooking due to the anxiety about seizures, even though their condition is well controlled, either by medication or from surgery. This can limit their participation in work, leisure, and self care occupations. In moderate to severe cases, frequent or unpredictable seizures can reduce independence significantly. often requiring supervision or environmental modifications to support engagement. Many people with epilepsy also live with common comorbidities such as cognitive impairments, anxiety, depression, autism spectrum disorder, or sleep issues. These can worsen fatigue, reduce attention, and increase social isolation, all which affect occupational performance. OTs must take a holistic approach that considers not just the seizures, but these interconnected cognitive, emotional, and social factors. The next part of my report outlines a range of technologies that could be used to support people with epilepsy. Mainstream technologies include smartwatches that detect seizures, mobile apps like Seizure Tracker, and virtual assistants like Alexa for daily reminders and also daily routines. Smart plugs and smart cooktops can also prevent injury during seizures, whilst telehealth and cloud based tools can be used to support therapy. Assistive technologies are more specialized. These include seizure alert systems like Embrace 2, anti suffocation pillows for violent seizures, fall detection mats, and speech generating devices. These tools all enhance participation in self care, productivity, and leisure occupations, especially when tailored to the individual's needs and preferences. For the final part of my report, we explore the barriers OTs face when using technology in practice, such as limited awareness of new or emerging technologies, lack of training on how to implement during intervention, or on how to educate the clients on how to use safely, as well as complex funding systems that make it difficult for the client to be able to afford these technologies. Strategies to address these barriers include integrating assistive technology education into occupational therapy courses or allowing the OT to stay updated with new technology through CPD training. As well as this, the OT can also use client centered tools like the COP-M to guide equipment prescription. This report also highlights the ethical responsibilities of the OT. Therapists must ensure informed consent, protect client privacy, and avoid over reliance on the technology that could reduce human interaction and therefore affect the client's well being. By taking thoughtful, collaborative, and ethically sound approaches, OTs can use technology to meaningfully improve quality of life for people living with epilepsy.
So, my topic explores utilising assistive and mainstream technology in occupational therapy to support the rehabilitation and recovery for individuals with Guillain-Barré syndrome, otherwise known as GBS. So GBS is a rare autoimmune disorder where the body's immune system mistakenly attacks the peripheral nerve system. Sometimes people with GBS often experience sudden, rapid onset of muscle weakness, fatigue, paralysis, pain. They often experience some sensory issues as well. Recovery can sometimes vary. Usually it would take weeks to years, making it really essential for OT intervention being early and ongoing. So as OTs, our role is to support function and participation by addressing the client's physical, environmental, and emotional needs. Some patients may experience complete paralysis, so emotional needs is quite a big part of the OT role when you're looking at GBS. This includes helping clients to regain their independence in basic ADLs, adapting to changing abilities, and trying to engage them in meaningful activities through utilization of mainstream and assistive technologies. So now we're going to have a little look at the occupational performance that you might see across the three different stages of recovery and sort of how OTs integrate their therapy into these stages of recovery. So in the initial phase, that's the first phase that you normally see. GBS looks quite different in this phase. individuals often require full support for basic needs. So things like hygiene, positioning, they sometimes even require assisted ventilator for breathing, limiting their ability to talk and communicate their needs. OTs focus on preventing further complications in this phase because the rehabilitation recovery stage is not appropriate when they're not medically stable yet. So OTs focus on preventing further complications like pressure care injuries, preserving their joint integrity, preventing contractures, things like that. And then we look at the plateau phase. And in the plateau phase, we normally recognize that their symptoms will stabilize. They don't worsen, they normally just stay the same. So ongoing support for OT is still required in this stage, and we look at things like supporting their comfort, anxiety management, and introducing some basic communication aids. Then we look at we're a little bit more involved in their recovery phase, their rehabilitation phase. This is usually where we'll start to see gradual improvements in their strength and endurance. They still experience some lingering fatigue and pain. It's really important for OTs to be aware of generally that when you're doing the upper limb retraining programs, that once the client actually starts to fatigue, it's best to stop, give them a rest, because it can actually set you back from all the progress that you've made throughout your rehabilitation phase. OTs often look at things like ADL retraining, retraining of daily tasks, grading the strategies that they're implementing, and reintroducing some occupational roles. So now we're going to have a little bit of look at some of the technology that's out there to support the recovery of GBS. Currently, research is really limited in terms of what supports are best for GBS recovery. At the moment, evidence does support that mainstream and assistive technology in OT can enhance functional independence and participation for individuals with GBS. So here I've got some of the mainstream technologies that are used to support GBS recovery that are currently supported by research, and some assistive technologies as well. So some of the things that we're seeing here, so things like telehealth, that can be really handy for individuals who have been discharged post-rehab into like rural and remote areas. So it just promotes continuity of care. Smartphones and tablets are great for communication, fatigue tracking, especially for GBS, because that is an ongoing symptom that you do see throughout recovery. Virtual assistants, so things like Siri, Google Home, Alexa, those are really great for hands-free control independence, so turning on the lights, turning on the TV, things like that. Smart wearables, again, for fatigue management, things like Apple Watches, Fitbits. And VR systems are also becoming more integrated into OT therapy for simulated environments, and it also promotes motivation during rehabilitation. Some assistive technology that we've got on there is things like mobility aids. So we're looking at things like powered wheelchairs, electroskeletons, just to promote that mobility. We look at transfer aids, so hoists, slide sheets, Serostetties. Those are equipment that we usually would see and use in the hospital, normally in the subacute rehab wards. And these are really great for just like care strain and care burden. Some more assistive equipment that we use is things like self-care aids, so long-handed sponges and long-handed shoehorns, adaptive cutlery, just to promote those everyday ADL independence skills. Communication devices, so after they've just had a ventilator, it can be really difficult to talk. So using things like eye gaze symptoms and systems are really handy to promote communication. Then it's really important when they go home, if they're a little bit unsteady on their feet still, or we just need to be a little bit more wary. Falls prevention wearables are also great assistive technologies for alarms and things like that to notify when a patient may experience a fall. So despite the potential for technology, we must acknowledge that the barriers are still outweighing the facilitators. For many clients with GBS, OTs are often lacking specialised training, so CBD, and with limited funding, especially short-term NDIS plans, it can be really difficult to access and maintain necessary technology that they might require. Clients can also feel overwhelmed and anxious about using particular technologies, particularly with the older adults who have lower digital literacy. There's also the social stigma around some of the technologies that are out there. That can be a barrier. The fear of dependence on particular technologies, not wanting to be using them forever. Devices can sometimes, due to the low continued professional development from OTs, can be prescribed incorrectly, which can lead to underuse of the patient and abandonment of the technology, which leads then again to poorer health outcomes for that patient. There are some really clear facilitators that support using these technologies. These include having client-centered goal setting, having peer mentoring with other people online that may have worked with a client with GBS, having like interdisciplinary communication and collaboration can be really helpful. There's also ethical considerations like equity, informed consent, privacy. Those are all really essential. And ultimately, we do need more evidence-based research specific to OT and GBS to guide practice. Education and funding structures must evolve so that we can deliver timely, effectively, and meaningful technology interventions can actually meet client needs.
I will now shift the focus specifically to Alzheimer's disease. My research highlighted the need for OTs to not only prescribe assistive equipment, but to also embrace mainstream digital tools as part of a modern client-centered care. This project examines the challenges individuals face, explores practical and evidence-based solutions, and outlines the evolving role of occupational therapy in adapting to the digital health landscape. Alzheimer's disease has a profound impact on occupational engagement, and this changes significantly as the disease progresses. In the early stages of Alzheimer's disease, individuals often retain a level of independence but begin to experience challenges with memory, planning, and initiating tasks. This can lead to disruptions in routine, decreased confidence, and withdrawal from meaningful activities. At this stage, the occupational therapy role is to be proactive, supporting memory, routine, and function to preserve independence for as long as possible. As the disease progresses, cognitive and physical functioning begin to deteriorate. Clients may be unable to complete basic self-care tasks, are at a high risk of falls or wandering, and often disengage from daily life. The OT's role shifts to become more focused on modifying tasks and the environment, as well as utilizing both assistive and mainstream technology to improve safety and reduce caregiver burden. There is strong evidence to suggest that assistive technology can support occupational performance in Alzheimer's care. Assistive technology such as grab rails, raised toilet seats, fall detectors, and pressure sensor mats have shown to enhance safety, support mobility, and reduce caregiver stress across all stages of the disease. Mainstream technologies are underutilized but hold enormous potential. Devices like smartwatches can offer fall detection reminders and GPS tracking, helping with routine, safety, and health monitoring.
Voice assistants like Google Nest or Alexa provide verbal prompts, routine support, emergency calling, and can control the environment to reduce cognitive load. Tablets or mobile games such as crosswords or memory apps have shown cognitive benefits and maintain engagement in familiar, meaningful leisure activities. Despite these evidence-based benefits, there are still key barriers to technology use in Alzheimer's care. Firstly, digital literacy among older adults remains low, making it harder for clients and caregivers to confidently use these devices. Secondly, OTs themselves often lack training in digital technologies, which limits their confidence in prescribing or supporting these tools. Lastly, the cost and funding limitations can make access to helpful technologies difficult for many families. However, there are promising strategies to overcome these barriers. Digital literacy is improving among aging populations, and by the time younger, more tech-savvy generations reach older age, mainstream tech will be more accepted. For OTs, integrating technology training into university curriculum and professional developments is essential. It's also critical that OTs learn to build strong evidence-based justification to secure funding support through the NDIS and aged care schemes. Ultimately, our role is not just to keep up with these changes, but to lead them, ensuring that every tool possible is available to promote independence, safety, and dignity in people living with Alzheimer's disease.
Now, moving on, Parkinson's disease is a progressive neurological disorder that affects movement and function caused by the degeneration of nerve cells in the brain. It is the second most common neurological disorder in Australia, which presents with a combination of motor, cognitive, and psychosocial challenges that significantly affect daily functioning and participation in meaningful occupations. The aim of my chapter was to explore how occupational therapists can use both assistive and mainstream technologies to enhance safety, independence, and occupational engagement for people who live with Parkinson's disease. This presentation looks at three key areas. Firstly, how Parkinson's and common comorbidities impact daily occupations in productivity, self-care, and leisure. Second, the technologies that can be integrated into OT practice. And finally, the OT's role in addressing barriers and ethics to technology use and tailoring interventions to the person's goals and environment. Considering these factors helps us better understand how technology can support meaningful participation in occupations across the progression of the disease. Parkinson's disease symptoms progress gradually, with noticeable symptoms even in early stages. Individuals may experience subtle motor symptoms and fatigue that interfere with fine motor tasks like handwriting, grooming, or preparing meals. Psychological impact, including reduced confidence, fear of symptom progression, and social withdrawal, are also common in early stage Parkinson's disease. As Parkinson's disease advances, motor impairment such as freezing of gait, muscle stiffness, and increased risk of falls can make daily tasks and occupations more time-consuming and unsafe. These difficulties often lead to reduced participation in self-care, productivity, leisure, and community roles. Common comorbidities such as cognitive decline, depression, and anxiety, arthritis, sleep disturbances, and chronic fatigue further reduce stamina, affect routines, and increase functional challenges. These challenges require a holistic OT approach that addresses the physical, cognitive, and psychosocial factors to maintain participation and independence throughout the progression of Parkinson's disease. Technology plays an important role in supporting daily function and participation for people living with Parkinson's disease, particularly when matched to their needs and stage of progression. Mainstream technologies like smartwatches can track tremors, detect falls, and send medication alerts, helping clients monitor symptoms and maintain safety. Voice assistants such as Google Home or Amazon Alexa allow for hands-free control of lights, appliances, and reminders, supporting independence for those with tremors or limited dexterity. Mobile apps can assist with symptom tracking, medication routines, and help maintain social connections. Telehealth improves access to care, especially when fatigue or driving limitations make in-person appointments challenging. Assistive technologies offer targeted support. Laser-guided walkers and rollators can help reduce freezing of gait and support pacing during mobility. Weighted utensils and adaptive cutlery make mealtime safer and more independent. Medication dispensers can improve routine adherence and symptom control. Dressing aids reduce the need for fine motor coordination, and visual schedules can help with managing memory and routine planning. Together, these technologies enhance safety, promote independence, and support meaningful participation in daily occupations. As occupational therapists, it's important that we acknowledge the barriers to implementing technology with Parkinson's disease populations. These can include physical limitations like tremors, cognitive challenges like memory loss, or even financial barriers that limit access to useful devices. Therapists also face their own barriers, like limited training or uncertainty about using new tools. To address this, strategies include providing hands on training, offering tech literacy support, and advocating for accessible funding. It is also essential that interventions are tailored to the individual's goals, routines, and environment. Ethically, we must prioritize informed consent, especially when cognitive impairment is present. We should also consider data privacy, especially with smart technologies that store sensitive health data, and ensure that clients understand how their information is used. Importantly, we need to avoid over-reliance on technology. Tech should enhance, not replace, human connection or engagement in meaningful occupations. Finally, as Parkinson's disease progresses, tech use should regularly be reviewed and adapted to ensure it continues to meet the client's needs and values.
So in this part of the presentation, I'll be going through multiple sclerosis, also known as MS. MS is a chronic autoimmune disease that attacks the myelin sheath, disrupting the central nervous system. So essentially, this leads to the impairment of neurological functions of a person. MS currently affects young adults, particularly women, and it presents with a diverse range of symptoms such as limb paralysis, cognitive and emotional decline, and bladder dysfunction. So essentially, these impairments often lead to individuals' ability to engage in everyday activities, affecting their occupational performance and quality of life, according to Benito Leon in 2020. The research shows that many people that have MS face challenges in self-care, productivity, and leisures. So this case study will explore the integration of mainstream and assistive technology to improve independence for someone who's diagnosed with MS, and the roles that OT plays with maintaining, restoring, and adapting functions in this population. There are multiple stages of MS. As previously mentioned, MS can begin in young adulthood as clinically isolated syndrome. Early symptoms include fatigue, vision problems, and often disrupts daily routine and social participation. Individuals in this stage often experience anxiety and depression due to stigma, which limits social and occupational engagement. As MS progresses to relapsing remitting MS, unpredictable relapse affects cognitive and mobility function, resulting in a reduction of occupational performance in all ADL tasks such as dressing or cooking. Eventually, many develop secondary progressive MS, which brings on ongoing functional declines and early retirement due to function loss. In late stages with primary progressive MS, individuals may become fully dependent, requiring mobility aids and carer support for basic tasks. Therefore, occupational therapy is required throughout all stages of MS to maintain quality of life and adapting environments. OT plays a vital role in AT prescription. AT promotes functional independence, support people with maintaining daily routine. For instance, mobility aids such as walkers and wheelchairs will allow for people with lower limb weakness to move safely in their homes and community. Self-care aids such as button hooks over toilet frames and waste cutlery enables people to continue to participate in essential ADLs such as dressing, toileting, and eating. There are notable changes in speech and communication barriers amongst people with MS, so they may benefit from speech-to-text software and text-based apps to support ongoing meaningful interactions. In addition to specialized AT, mainstream technologies have become increasingly useful. There are reports of 85% of individuals with MS using smartphone. Smartphones are supportive as it provides symptom tracking, provides reminders, assisted navigation, and improved access to social media platform. Features like voice commands, screen magnification, and video calls enhance usability for those with any visual impairments. Further, their VR, visual reality, is another emerging tool in occupational therapy, which simulates real-life environments to support motor and cognitive rehabilitation. Integrating AT and mainstream technology empowers individuals with MS to remain engaged in meaningful activity, maintain independence, and enhance quality of life. When it comes to prescribing assistive technology for people with MS, key barriers include cognitive challenges such as memory and planning, lack of user training, and limited clinical knowledge. These issues can reduce the effectiveness of AT, ultimately resulting to AT abandonment. However, successful implementation is supported by clinical education, user-centered prescription based on individuals' needs, and growing awareness of mainstream technology. Together, these enablers help improve the daily participation and independence for people with MS.
My part of the project explores how occupational therapists can integrate mainstream and assistive technology to support individuals recovering from stroke in regaining independence in daily occupations and improving their quality of life. So, stroke is a result of disruption of blood flow to the brain, which then leads to damage or death of brain cells. Stroke impacts physical, cognitive, sensory, and emotional function, and therefore impacts occupational engagement. This project examines the challenges faced by stroke survivors in their daily occupations and investigates how mainstream and assistive tech can enhance independence. Furthermore, it discusses the barriers and facilitators for OTs and patients when implementing these technologies. Stroke-related impairments affect engagement in daily occupations across various stages of recovery. These stages include acute, subacute, and chronic. In the acute stage, the focus is on medical stabilization and prevention of secondary complications. The OT's role here is early assessment, managing positioning, pressure care, and providing education for the patient and their family. During this stage, there is limited functional engagement due to medical instability, fatigue, and cognitive confusion. Moving on to the subacute stage. Here the focus is on restoring function and promoting independence. The OT's role here is to support task-specific training, environmental modifications, to prescribe adaptive equipment, cognitive retraining, and fatigue management. And lastly, the chronic stage. Here the focus is on long-term rehabilitation and managing residual disabilities. The OT's role here is to support adaptation to long-term needs, maximize function with assistive and mainstream technology, and also to facilitate community re-engagement. Smartphones and tablets are mainstream technology which helps to advance independence through applications such as reminders, calendars, alarms, and to-do apps. These can assist individuals with memory loss, attention deficits, or executive dysfunction caused by stroke. Furthermore, the video call, texting, and voice messenger features can assist individuals with aphasia or speech difficulties as it helps reduce social isolation. Moving on, smartwatches and fitness trackers such as Apple Watches or Fitbits can assist in tracking heart rate and sleep, which in turn can help assist in monitoring fatigue levels. Additionally, they also have falls detection and emergency alert features, which assist in decreasing anxiety and increasing confidence when participating in the community. Voice-activated smart home devices such as Alexa or Google Home allow individuals with mobility impairments to control lights, appliances, and security systems through voice commands or apps, which as well enhances independence in household management and fosters autonomy. Virtual reality has emerged as a new approach for providing stroke rehabilitation for motor and functional retraining, so it can be implemented into interventions by OTs to assist in simulating tasks and environments in a safe and controlled virtual environment. Moving on to assistive tech, so OTs may prescribe wheelchairs, both manual power, to facilitate safe mobility and increase access within both the home and community environments. Additionally, hand splints also specifically assist with positioning and movement of the hand, reducing pain and swelling, which can support functional grasp, which is required for things like dressing, eating, and grooming. Additionally, the functional electrical stimulation devices apply electrical stimulation to certain muscles in the upper extremities, and this allows for purposeful movements and therefore also supports neuroplasticity. The robotic-assisted devices have been designed to assist with upper limb function through repetitive and task-specific practice. They also help enhance neuroplasticity and motor recovery, and therefore help individuals improve their ability to engage in meaningful occupations and increase their quality of life. Adaptive equipment for activities of daily living. So OTs may prescribe built-up cutlery, button hooks, sock aids, long-handled sponges, one-handed chopping boards, easy reaches, non-slip mats, shower chairs, or over-the-toilet aids. So these technologies enable individuals to complete tasks, ADL tasks or IADL tasks with increased independence. Occupational therapists face several barriers when using technology in stroke rehabilitation. A major issue is limited knowledge and training, which makes it hard to keep up with evolving technologies and leads to underuse of tools. There is also often poor tech infrastructure, which means little support for installation, troubleshooting, or concerns about recommending non-medical looking devices. Cost, stigma, and access issues, especially in low-income settings, further limit technological use. Some strategies that we can use is considering client factors such as digital literacy, motivation, and attitudes towards technology. We can also involve families to help build confidence. We should also provide OTs with training and ongoing professional development surrounding technological use. We should also use evidence-based resources and advocate for funding and systematic support to improve access. All right. Some ethical considerations that we need to look at is informed consent. So stroke survivors should fully understand how the technology works, its benefits, limits, and risks. Equity of access is also important. We need to advocate for fair access as well. And confidentiality and privacy means that sensitive data must be protected as in line with the OT Code of Ethics. In conclusion, neurological conditions like epilepsy, GBS, Alzheimer's, Parkinson's, MS, and stroke create diverse challenges that affect how individuals engage in daily life. Technology, when used effectively, can support safety, independence, and meaningful participation. As occupational therapists, we are uniquely positioned to assess individual needs and integrate assistive and mainstream technologies into personalized interventions. It's crucial that we do this ethically, collaboratively, and in a way that aligns with our clients' values and goals.
Despite the growing use of technology in OT, there are still major gaps that we need to address. Many therapists lack formal training in assessing and integrating both assistive and mainstream technology, especially for complex neurological conditions. There also is limited research on how emerging tools like AI and VR perform over real world settings, making it harder to confidently apply them in practice. Funding schemes like the NDIS can also be inflexible, often overlooking clients with fluctuating conditions. Accessibility is also another concern, especially for people in rural or remote areas or low income areas who can't access or afford these technologies. To bridge these gaps, OTs need stronger education at both a university level and through ongoing CPD training so that they can implement technology safely and effectively as a part of accessible evidence-based care.